In this podcast episode, Elliott Grant, a chiropractor and movement specialist, delves deeply into the critical relationship between posture, movement, and overall health, particularly focusing on how poor posture and sedentary habits contribute to back pain, accelerated aging, and decreased lifespan. Throughout the conversation, Grant shares practical advice, evidence-based exercises, and a fresh perspective on common misconceptions surrounding posture, pain management, and rehabilitation. Grant begins by highlighting the often overlooked consequences of bad posture. Beyond causing physical discomfort and pain, poor posture can visually age a person and diminish their confidence. He explains that prolonged sitting typically places the lower and mid-back in a flexed, rounded position, which not only leads to stiffness and pain, but also creates a hunched appearance often associated with aging. This shrimp-like posture is a warning sign of decreased lifespan and overall health deterioration. However, Grant emphasizes that the solution is not about maintaining a perfect posture at all times, a concept he calls arbitrary and unrealistic, but rather about movement variability. He compares the spine to an elbow joint, explaining that holding any one position for too long, whether slouched or perfectly straight, leads to discomfort and dysfunction. The best posture, he asserts, is the one you are in for the next 5 minutes, encouraging listeners to frequently change positions and incorporate movement throughout the day. For those stuck at desks or in meetings, Grant offers 2 simple yet effective exercises that can be done without leaving the chair. The first is a thoracic extension, where one interlocks their fingers behind the neck and hinges backward over the chair's backrest repeatedly. This movement helps unlock the mid-back, counteracting the rounded posture from sitting. The second exercise targets the lower back and hips through pelvic tilts. By alternating between arching the lower back, anterior tilt, and tucking the pelvis under, posterior tilt, one can mobilize the lumbar spine and improve circulation, reducing stiffness and pain. These exercises, when performed 3 times daily, morning, afternoon, and night, can significantly improve spinal health and posture. Grant encourages listeners to take breaks from sitting and engage in more dynamic stretches. One such movement involves kneeling and leaning the elbows on a chair while pushing the chest toward the floor, promoting thoracic extension and shoulder opening. Another involves leaning the upper body on the chair while allowing the hips to sink forward, stretching the hip flexors and extending the lower back. These movements help reverse the constant flexion experienced during prolonged sitting and are essential for maintaining spinal mobility and reducing pain. A central theme throughout the podcast is the importance of movement variability. Grant explains that joints, like windshield wipers, need to move through their full range of motion to stay healthy. Neglecting certain movements leads to dust and rust accumulating in joint corners, which can cause stiffness and pain over time. He stresses that movement alone is not enough. Strength training is equally vital. Many people lack sufficient strength-based exercise in their routines, often due to fear or misinformation. Maintaining muscle mass, especially as one ages, is crucial for supporting posture, reducing pain, and preserving youthfulness. Grant advocates for a balanced approach that includes cardiovascular exercise, strength training, and consistent movement throughout the day. Neck pain is one of the most common complaints, often linked to poor posture and prolonged forward head positions, such as tech neck. Grant explains that the neck's anatomy means the top part is often extended while the lower part is flexed in these positions, causing tension and discomfort. He introduces the chin retraction or chin tuck exercise as a simple yet powerful tool to counteract this. By gently pulling the chin backward, as if making a double chin, one realigns the neck, reducing strain and improving mobility. Performing this exercise regularly, 3 times a day, with 10 repetitions each time, can alleviate neck pain and prevent further issues. Grant tackles the widespread fear surrounding back and neck pain, particularly the misconception that pain always signals serious damage. He explains that disc bulges and herniations are common and often asymptomatic, meaning many people have them without pain or dysfunction. Unfortunately, imaging often reveals these findings, which can lead to unnecessary fear, overtreatment, and even surgery. He advises that imaging should be reserved for cases with red flags, such as progressive neurological deficits or signs of infection, fracture, or tumor. Most back pain can and should be managed conservatively with movement-based rehabilitation rather than relying on imaging or passive treatments alone. A recurring message is that passive therapies, such as massage, ultrasound, or electrical stimulation, while sometimes helpful for temporary relief, are insufficient on their own. True recovery requires active participation from the patient through movement, exercise, and education. Grant emphasizes that the goal of any treatment should be to empower patients to manage and fix their own bodies, reducing dependency on providers or medications. This approach not only leads to better outcomes but also restores confidence and control over one's health. The podcast also addresses common lifestyle factors that listeners often blame for their pain. Grant clarifies that sitting itself is not the new smoking, but rather the lack of movement is the real culprit. Sitting for long periods without breaks can accelerate aging and pain, but regular movement breaks and exercise can counteract these effects. Regarding shoes, Grant acknowledges that footwear can influence posture and pain, especially in cases like high heels, but it is rarely the primary cause. He advocates for minimalist shoes in some cases to improve foot grounding and muscle activation. On pillows and beds, he advises not to blame them for chronic pain, as the underlying issues usually stem from the body itself. However, comfort and proper support during sleep can influence symptoms, especially when traveling. Diet is discussed as a secondary but important factor. While movement and rehabilitation are primary, reducing systemic inflammation through diet can enhance recovery, particularly for those with inflammatory conditions or who plateau in their progress. Grant provides a clear explanation of sciatica, describing it as pain radiating along the sciatic nerve, which originates in the lower back. He stresses that while symptoms appear in the leg, the root cause is almost always in the lumbar spine, often due to disc bulges irritating nerve roots. Many people mistakenly focus treatment on the leg symptoms, such as stretching tight hamstrings or massaging the calf, which can worsen nerve irritation. Instead, effective treatment targets the low back to reduce nerve compression and inflammation, leading to symptom resolution. In closing, Grant addresses listeners who may feel jaded or hopeless after trying multiple treatments without success. He encourages persistence and an open mind, reminding them that recovery often requires multiple attempts and finding the right approach. He likens this to other areas of life where the first attempt may not succeed, but continued effort leads to success. Maintaining belief in recovery and actively seeking movement-based solutions is key to overcoming chronic pain and improving quality of life.